So what is mast cell activation syndrome? We're going to go back to the basics on this one. Hi, I'm Dr. Joyce. I'm a naturopathic doctor, and I see a lot of complex chronic illnesses like mast cell activation syndrome. So mast cell activation syndrome is kind of a descriptive syndrome here. It essentially is describing the inappropriate activation of something called mast cells. Now, mast cells are these cells that are part of the white blood cell community in your body. So they normally have higher populations in barrier type of tissues. So things like skin, the gastrointestinal tract, the respiratory system, things like that, although they do exist in other tissues in your body as well. And their main job, along with things like eosinophils and basophils, which are other types of white blood cells, is to be guardians at these boundaries and be immune modulators for keeping threats out, right? A lot of the mediators that mast cells use are things that are effective and destroy things very quickly when they cross your boundaries. So when mast cells detect threats, what they do is they release mediators that cause a lot of inflammation so that your body can respond appropriately and get rid of these threats. Some of these mediators include things like histamine, prostaglandins, leukotrienes, and that kind of stuff. What happens in mast cell activation syndrome is that these mast cells are inappropriately activating whether or not there's an appropriate threat. So these mast cells are then releasing these mediators even though there's not an appropriate threat there. So they're dumping a lot of histamine, a lot of prostaglandins, a lot of leukotrienes into the system at the points in which they are existent and causing a lot of symptoms there. So these symptoms can be things like itching, hives, swelling, gastrointestinal symptoms like nausea, diarrhea, cramping, respiratory symptoms like the feeling of throat closing, chest heaviness, wheezing, cardiovascular symptoms like palpitations, feeling like you're going to pass out, blood pressure issues, things like that. So like wherever the mast cells are and wherever they're dumping these mediators in, you're going to have symptoms. So mast cell activation syndrome, by definition, is the inappropriate activation of mast cells that is causing symptoms in two or more systems in the body in a recurrent fashion that keeps happening with or without apparent trigger. So that is what mast cell activation syndrome is. It's typically harder to diagnose. People don't know a whole lot about it, and it can be harder to pinpoint just because a lot of the symptoms are so multi-system that it can look like really weird presentations. There can be a lot of different presentations depending on which organ systems are involved, and it can look like other diagnoses that need to be ruled out first. So yeah, that's mast cell activation syndrome in a nutshell.